So first we're going to talk about how to assess dermatomes and myotomes of the spinal cord. And the rationale for wanting to assess dermatomes and myotomes is if you suspect an injury to one of the nerve roots. All right? So just to review the anatomy, right, we have our spinal column here, and in between the spinal column you have discs, okay? And within the center of the spinal column is the spinal cord. Going out from the sides of the spinal cord are the nerve roots. We recently learned about the brachial plexus. So the brachial plexus is made up of several areas, right? So it starts with the roots, the nerve roots, then it goes to the divisions, then it goes to trunks, then it goes to cords, and it eventually ends as peripheral nerves, okay? So when we're talking about assessing the dermatomes and myotomes, we're talking about irritations to the nerve roots. So just off of the spinal column where they come out of the spinal canal, all right? So a dermatome is a sensory assessment and a myotome is a motor assessment. When you assess for dermatomes and myotomes, you need to assess for both the sensory and the motor, meaning the dermatome and the myotome. So let's go through how to assess each of the dermatomes and myotomes for the upper extremity. First, I'm going to go through the dermatome assessment. So the dermatome assessment, you take a reflex hammer, you have a sharp on top, and then on the bottom of a reflex hammer, if you unscrew that, you also have like a dull. A reflex hammer, okay, you can use a fingernail, you can use a paper clip, okay, or if you have the reflex hammer, use the sharpened dull. And what you want to do is have the patient close their eyes and you're asking them to discern the differentiation between the sharp and the dull. So we'll have the patient close their eyes and we'll do C1, C2, which is the top of the head, okay, and I'll just do sharp. And I'm not going to tell the patient that I'm doing sharp or dull, but I would say to her, does this feel sharp or dull? Patient? Good. So that's C1, C2. C3, okay? C1, C2 is just top of the head. Okay, C3, now you're going to do everything bilateral. Alright? So, sharp. Does 1 feel the same as 2?
Yes.
Yes. Okay? So if she had a nerve root irritation on the one side, she may indicate that it feels less sharp. Okay? Meaning irritation at maybe possibly C3. Alright? C4 is top of the shoulders. Okay? Again, bilateral. Does that feel the same?
Mm-hmm.
C5 is right in the middle of the deltoid. Feel the same?
Yes.
Okay. C6, you're now going to have them palms out. Okay. Web space of thumb and finger. Feel the same?
Yes.
Okay. C7 is your index finger and middle finger. Feel the same?
Yes.
T8 is palm surface of the little finger. I said T8, it's C8. All right, feel the same.
Yes.
And then T1 is right up at the upper medial arm. And feel the same.
Yeah.
Okay. So that's how you would do dermatome assessment for the upper extremity. After you're done dermatome, you have to do myotome. So this is the motor function, okay? So technically what we're doing is we're performing manual muscle tests, all right, in essence, right? We're doing brake tests, and which makes sense because if you think those nerves eventually innervate the muscle and allow the muscle to function, all right? But we are now assessing them for an irritation at the nerve root rather than an injury at the muscle itself, i.e. a strain, okay? So we're going to do myotome testing. So C1, C2 is going to be neck flexion, and you always want to do these against resistance. Push against me. Good. And push back. Good. And as the clinician, you're looking to see if they have a difference from side to side, okay, in terms of a decrease in the function or strength. Push. C3. Push. Good. C4. Shut your shoulders up. Okay, C5, elbow out. Okay. C6, we're going to do elbow flexion and wrist extension. Okay. So depending on the size of the athlete, you might not be able to break their elbow, but you may be able to break them at the wrist. Okay. So either or. Ready? Hold. Good. Okay. Hold that there. Good. And again, compare bilaterally. Good. C7 is elbow extension and wrist flexion. It looks like a 7. Okay? Hold there. Good. I'm going to break you out of this. Good. Hold there. Good. I'm going to break you out of this. Good. Okay? C8 looks like an 8, so what you're going to do is finger flexions, okay? And just hold them there and don't let me break you out. Good. And then T1 is finger ab and adduction. Okay? So just to review, dermatome testing is for sensory component of an irritation of the nerve root. Myotome testing is for motor function of the nerve root. You need to test bilateral, and for dermatome, you're looking for a decrease in sensation from side to side. For myotome testing, you're looking for a decrease in strength from side to side.